have the state-of-the-art Da Vinci robotic platform to do robotic surgery at Apollo Hospital. We were one of the first hospitals in Hyderabad to adopt this technology, and we have been doing robotic surgery for the last 8 years, since 2012. It's a multidisciplinary department, so many departments use this other than gynecology. However, in gynecology, we have taken the lead in this country to offer robotic surgery for complex gynecological problems to women. So today, Apollo Hospital Gynecology Department here, along with me as one of the lead faculty, provides one of the largest numbers of robotic surgery for the whole country. Robotic surgery for patients is a very comfortable surgery, because as I mentioned, they come on the morning of surgery and either go the same evening or the next morning. The pain is minimal. They very rarely require any kind of blood transfusion. When the patients have this kind of surgery, they are put back on their oral feeds within 3 to 6 hours. They are back on their feet the same evening. They are able to walk up to their washroom. They can go, they can eat, they sleep well. So most of the patients after 2 or 3 days tell me they don't even feel they had a surgery, which is the biggest advantage and a compliment that we get after doing robotic surgery for patients. These kind of minimal access surgery, the multiple times patients need not come back to us. And the technology that we are using today, we are actually often talking to patients online or on video consult within a week of the surgery and understanding what their problems are. Very rarely a patient actually needs to come back to us in the hospital for anything, because there is really nothing we need to do for the patient. There are hardly any stitches, there are no stitches to be removed, there is no pain. Patient is taking oral medications or oral feed. So there is no need for patient to be coming to the hospital again and again. So we manage the patient with minimal visits to the hospital. We do big surgeries only on robotic surgery. The complex patients who take high skilled kind of surgical expertise are being offered robotic surgery, and we are able to give good outcome with minimal discomfort to the patient and quick recovery. For public to understand is, first of all, to understand that there is no myth. The second thing, that public has a concept that robotic surgery will take very long, which is not true. There's days when anything is new, it takes longer time or it takes people to settle down. But here at Apollo Hospital, we have been doing for 8 years. Today, our robotic surgery timing is probably at par or even less than what we were doing in laparoscopic surgery. The third thing that public understands is robotic surgery is expensive. Yes, if you look at the end of the day, you may feel that robotic surgery is expensive, but you have to look at the overall picture. Now, the overall picture talks about not just the amount you spend just for the surgery, but it's the workforce, or it's the amount of the productive days that you gain by quickly recovering is what compensates for what you do. Many of us do not feel anything in spending money for an expensive holiday or an expensive anything else. But we always feel the pinch when there is an expensive form of treatment. But we have to understand that technology is improving the life in every field. Why medicine should be left behind? Why surgical specialty should be left behind and not use technology to give the best to you? And that's what we are trying to do by using robotic technology in our day-to-day surgical armamentarium. To my women in the society, I would say you are the best. You are the most hard-working force here. I also understand that women work double or triple times anybody around them. They are always on their toes trying to make something or the other better, either in their professional front or their home front. What you need to understand, I will give you the example of the airline. Now, when there is a low pressure in the airline, what do they say? Put your mask first and then attend to the next. That same holds true for your health. Take care of your health first and then take care of everybody else. Because if you remain healthy, you are the nidus of your family and the society. You are healthy, everybody else around you is healthy. You are happy, everybody else is around happy. So that is one message which I have learnt the hard way, and I would like to impart to all the women out there.